it's my sense that we're missing lots of factors in our analyses, because what's actually true is we can describe these disparities, but we can't really answer the basic question of how come we have them. We can describe some basic characteristics of life that are associated with them. We can say things like having a high school degree makes a really big difference in what's going to happen next. Having a college degree has some influence, not as much as a high school degree, but it has some influence. So, okay, fine, education has something to do with something. But we can't really do a nuanced description of what are the inflection points in people's lives. My name is Ruth Finkelstein, and I'm the executive director of the Brookdale Center for Healthy Aging, which is a research and policy center at Hunter College. And I'm also a professor of public health at Hunter. It's no secret that there's a big variation in the health and well-being of older adults, right? This is like, there's been a lot of news about it, a lot of research about it. We know, for example, that there's a big gap in life expectancy between those people who are higher income and those people who are lower income. We know that over the last 50 years, the life expectancy of people overall has grown, but actually that hides the fact that people who are low and middle income haven't had a growth in life expectancy. It's just that people who are well off have had such a big growth and a ever bigger growth in life expectancy that it obscures the fact that some people are staying the same or actually living less long. We know that there's a really big gap in the healthiness of older adults. For example, if you measure by race, you find that women who are Black at the age of 51 have the same number of health conditions and level of health as women who are white who are 70. That's a really big gap. So how come we're so much less good at the why than the what? Well, there's a couple of different reasons. I've been thinking about this really deeply and looking into it via a number of questions I'm interested in personally. And I discover that the questions I'm interested in, there's no data about them. And I think to myself, well, why in the world is there no data about these questions? Why is there no national data set describing people's income that they get from working off the books as well as on the books? How come we don't understand people's communications barriers to learning about the help that's available to them? All these, to me, really basic questions. Why haven't we described and measured and researched the way that poor families and all kinds of families help one another? Researchers don't think about the fact that the people that they're interested in understanding live lives that are different than their life, or live lives like the part of their life that they've chosen to forget about, right? And so it's not our common practice to start when we think we have a question or we think we have an issue, we think we're on to something. Step one needs to be to talk with the people that we're talking about, to check in with them. It might just be that we're on the wrong track altogether based on our experience, or it might just be that there are critical elements of people's experience that we don't understand. It's my sense that we're missing lots of factors in our analyses, because what's actually true is we can describe these disparities, but we can't really answer the basic question of how come we have them. We can describe some basic characteristics of life that are associated with them. We can say things like having a high school degree makes a really big difference in what's going to happen next. Having a college degree has some influence, not as much as a high school degree, but it has some influence. So, okay, fine, education has something to do with something. But we can't really do a nuanced description of what are the inflection points in people's lives. I believe that we have to move into a new generation of really mixed methods where we use the stories of people's lives to understand those elements of lives that make changes, that have material and emotional and psychological and every kind of difference for the rest of their lives. We need to understand your life better, and then building up from that to a recognition of patterns, a recognition of data that it's important to collect, not just for you, but for everybody, and an improvement on the information that we have available to us to understand why things come out so differently. And why do we need to understand that? We need to understand that because we need to change it. We need to understand where there are inflection points, where there are opportunities to make things go differently. The reason that this matters is because everybody has to have the same opportunities to age as well as anybody can. A group of people that researchers can't see, don't see, won't see, are people who are incarcerated. And here's the thing. Even though people are incarcerated for a really long time, and that means that the average age of people who are in prison has risen and risen and risen because people have aged into being old while in prison, they still come out. Not enough of them, but some of them still come out. They're released into the community, where we discover that the woefully inadequate reentry services that we have for anybody who comes out of prison are completely not suitable for older adults who come out of prison. There is no integration conceptually between aging services and reentry services. Like, those things are just different universes. Yet the things that people who come out of prison need in order to survive are significant. They need, shockingly, the same things everybody needs: somewhere to live, some money to live on, meaningful work to do in the world to make a contribution, and social connections with their families of choice, their communities, right? That's what they need. Yet there are barriers to all of those things in our policy frameworks, one after another, and lacunae in our suite of services. So let's start with something as basic as, what are you going to live on? Where are you going to get money from? Well, where do older adults get money? They get money from Social Security, right? Oh, yeah, no, not so much. If you've been incarcerated, you've been working that whole time, but that doesn't count as work. The work that you do in prison is not considered employment. They don't pay into your Social Security, and so people leave long stints of incarceration and have no Social Security. If they're over 65, they can apply for SSI, a fraction of the amount of money. If they're under 65, they have to apply for SSI disability, which they may qualify for, given how terrible health care is in prison and given how unhealthful the life circumstances and conditions in prison are. However, the qualification for that takes years. So let's just say that that safety net isn't so very safe. So, okay, there's income, all that's fixed, right? Check. Not so much, and there's a little bit of state and local assistance, but it's really minimal. It's designed to augment federal benefits, not to be instead of federal benefits. So then we move on to healthcare access, right? Oh, yeah, well, that's dependent on Social Security if it's Medicare, and it's dependent on SSI if it's Medicaid. So that's going to be a little bit challenging. Then there's housing, and the instances of housing discrimination for people who are just formerly incarcerated are very well documented. People whose families live in NYCHA housing, if they had a drug-related incarceration, can't go back. So that's some barrier, and employment discrimination is obviously quite rampant for that population, as well as if you're old and formerly incarcerated and have a gap in your employment, shall we say, it doesn't matter how many certifications and skills and gifts you have, how talented you are, what you know. Those characteristics matter. The research that we're doing is based on our having developed over years relationships with a number of organizations of people who are formerly incarcerated. And over that time in which we have been working on the issues important to them, we have built a relationship of trust so that when we came and said, we would like to understand this issue from your perspective, people said, yes, we would be interested in talking with you about that. We trust you to listen to our stories, and then we trust that we will collaborate in the way that you tell that story so that it doesn't further damage and hurt our opportunities in the world. This is a trust that touches me deeply and that I'm honored to have, because the people that I'm working with in this context have not been treated well by a lot of systems and people and structures that look like me. And so that we can move beyond that first impression and their stereotypes of me to be willing to work together with me is one of the gifts that I have in my life, and I'm proud of it. And I look forward to developing those relationships of trust in further communities to further help their stories to come forward and then be translated into the kind of data that other people will collect in systematic ways in national surveys and then analyze to make bigger, broader generalizations than I'm able to do by talking to my 30 guys and women here in New York State. But it's contributing to the steps of that process.